Welcome back to our channel. Today we're exploring the smooth MRI C-Spine procedure for adult patients. If you're wondering what this procedure entails and why it might be necessary, you've come to the right place. Let's get started. The smooth MRI C-Spine procedure is a non-invasive imaging technique that uses strong magnets and radio waves to create detailed images of the cervical spine, which includes the neck and upper back. This advanced imaging technology helps doctors visualize the spinal cord, nerves, and discs without exposing patients to radiation. Why might you need a C-Spine MRI? There are several reasons, including chronic neck pain. Persistent discomfort may indicate underlying issues. Injuries. Trauma from accidents can lead to fractures or soft tissue damage. Herniated discs. Bulging or ruptured discs can compress nerves. Degenerative diseases. Conditions like arthritis or spinal stenosis can narrow the spinal canal. Tumors. Identifying abnormal growths can be crucial for treatment planning. During the procedure, you'll lie down on a padded table that slides into the MRI machine. The process typically takes about 20 to 45 minutes. While it may feel a bit confining, you'll be in a calm environment with plenty of airflow. Earplugs or headphones will help minimize the noise produced by the machine. Based on the MRI results, your doctor may recommend various treatments. These can include physical therapy, exercises to strengthen neck muscles and improve mobility. Medications, anti-inflammatory drugs or muscle relaxants may be prescribed to manage pain. Injections. Corticosteroid injections can provide relief for inflammation. Surgery. In severe cases, procedures like discectomy, laminectomy, or spinal fusion may be necessary to alleviate pressure on the spinal cord or nerves. While the MRI itself is safe, some patients may experience mild side effects such as anxiety or claustrophobia. Some individuals feel anxious in confined spaces. Noise sensitivity. The loud sounds of the MRI machine can be unsettling. Contrast reactions. If a contrast dye is used, there's a small risk of allergic reactions or discomfort at the injection site. However, serious side effects are extremely rare. To summarize, the smooth MRI C-Spine procedure is a safe, non-invasive way to assess cervical spine issues. It's essential for diagnosing conditions like neck pain, herniated discs, and tumors. Treatment options range from physical therapy and medications to surgery, depending on the diagnosis. Understanding potential side effects can help you feel more prepared and at ease during your visit. Thank you for watching our step-by-step guide to the smooth MRI C-Spine procedure for adult patients. If you found this video helpful, please like, subscribe, and hit the notification bell for more informative medical content. If you have any questions or personal experiences to share, leave them in the comments below. Stay healthy and informed.